I'm Caroline Watson, the Social Justice and Reproductive Health Intern for HIVE, a hub of positive reproductive and sexual health.
I'm Jenna Rep-West. I'm a program liaison with the San Francisco Department of Public Health, where I work primarily on transgender health initiatives with the health department.
So how do you identify first?
That's a really good question. So I'm many different identities, but I'm a trans woman of color, identify as queer, immigrant, multiple different identities. I grew up in San Francisco. I am in my 40s. I'm from an immigrant family, if I mentioned that earlier. So many different identities, but yeah.
So what ways do you think there are to improve electronic health records to better capture trans people?
Yeah. So electronic health records are this various data systems basically to track, record, and keep client records or patient files through medical systems. When I work with the San Francisco Department of Public Health, there are various medical systems of EHRs, basically electronic health records that we use to track patients. So how that fits in my work and with trans populations basically is there's a lot of inconsistencies in terms of gender identity and tracking gender identity within EHRs, and not just tracking but also reporting based on funding requirements from the different funding sources. So what you have is a multitude of multiple different arrays of EHRs that don't necessarily talk to each other. At the same time, some of the way in which it's been set up is not necessarily accepting or cognizant of the different gender identities that many trans people identify with. Usually, when they ask gender, it's usually binary, like male or female, and anyone not within that binary doesn't necessarily fall within that system or is recorded accurately or correctly. And not just that, as many trans people throughout their phase of transitions may have different kinds of names that they use over their lifetime. So depending on where the individual is, maybe even their name is not necessarily or accurately recorded or kept in those systems. Which basically causes a big problem in terms of anyone who's trans. It causes a lot of uncomfortability, both from a client perspective, who may be misgendered perhaps, or is called a name that they don't currently identify with, which causes a lot of uncomfortability again, and not being able to want to relate or be open with your provider. At the same time too, there's other health needs, specifically health needs, particularly for trans folks, that are necessary to keep. But if data systems don't accurately collect that information, then we don't, then it may be a missed opportunity for being able to identify what the health needs are based on their gender identity. So, for example, I mentioned earlier, for someone who may be trans female, who may not have had surgery yet, may be asked a gynecological exam if they don't know their history, right? But someone who probably hasn't had surgery yet, that can cause confusion, both from the provider end as well as the patient end, which causes a lot of frustration and, again, uncomfortability and misrecording of individuals. So one thing that we're trying to work on, basically, particularly with the health department, is a two-step model to ask gender, to think about gender. The first question would be, what is your gender? And with that question, we're allowing people to self-identify within the various different gender identities that fall within gender identity. So, and one option in that is, is an open field to self-identify to whatever gender you identify with. And then the other question to that follow-up is, what is your sex assigned at birth? So you all know when we're assigned at birth, there's only currently male or female gender marker that we're assigned at birth. For intersex people, it's currently usually what happens for intersex people. It's not, parents are usually asked to have their kids' gender marker checked mark as either male or female. Still, there's still a whole different issue on intersex and how that gets recorded. But again, that two-step model will basically allow us to capture people whose gender identities is not within the binary system.
Okay. And what are some of the gaps that you've identified in your work in improving EHRs?
Some of the gaps, I think, is just provider knowledge and provider information around gender identities, because gender is so expensive and gender expression is also expensive. There's a lot of maybe possible assumptions that's also been made. So without like the proper training and knowledge around gender and gender expressions, gender identity, and there could be a lost opportunity for mistreatment or dialogue around health priorities again. That's one thing. Another thing too is just being able to establish relationships. Most people pick a provider based on, open to their providers based on the relationships you have with your provider. So if you have systems that are not going to be responsive to people's identities, then that may potentially affect the way in which your relationship is with your provider or with your patient. So those are some of the gaps I think are really important to keep in mind. Yeah.
Okay, great. Thank you so much.
Thanks.